There's a health problem that quietly affects more people every year than many of us realize, and pancreatic cancer is one of the toughest to catch early. Most people over 60 have never been told in plain language what the early warning signs actually look like. I want to walk through them with you today, not to scare you, but because knowing what to watch for really can make a difference. The reason this particular cancer feels so frightening is simple. The signs can show up months before it becomes hard to treat, and they're easy to mistake for ordinary aging. A little more tiredness, a stiff back, a stomach that doesn't feel quite right. Most people explain these away, which is completely understandable because on their own, none of them sound alarming. But together, they tell a different story, and that's what I want to help you see clearly. Before we get into the signs themselves, it helps to understand why this cancer is so often found late. The pancreas sits deep in the body, tucked behind the stomach, where a doctor can't feel it during a routine exam and where standard blood work usually won't catch a problem until it's more advanced. This isn't a failure on anyone's part, including your doctor's, it's just where the organ sits. The tricky part is that the early symptoms overlap heavily with things we already associate with getting older, so they get brushed aside. Once you know what to actually look for, though, that overlap stops being a trap. Let's go through the signs one at a time. The first thing many people notice without realizing what it means is a change in urine color. It starts turning a darker yellow, sometimes closer to brown, like strong tea. The usual response is to drink more water, and for a day the color might lighten a bit, which feels like a relief, but then it darkens again. Here's what's actually happening. The pancreas sits right next to the bile duct, a small tube that carries a substance called bilirubin from the liver into the intestines. If a growth forms in the head of the pancreas, it can press on that duct and partially block it. Bilirubin backs up into the bloodstream instead of leaving the body normally, and the kidneys try to filter some of it out through urine, which darkens as a result. Drinking water doesn't fix a blockage, so the color keeps coming back. If your urine has been cycling between dark and lighter for more than a couple of weeks, regardless of how much you're drinking, that's worth a phone call to your doctor rather than something to keep managing on your own. The second sign is a specific kind of pain, and it's often misread as something else entirely, like arthritis, a strained muscle, or heartburn. This particular pain tends to start as a dull ache in the upper abdomen, roughly under the breastbone or slightly to the left, and it doesn't always stay put. It can wrap around toward the back, which is why people sometimes describe it as a tight band around the middle. This happens because the area around the pancreas has a dense network of nerves, and pressure from a growth can irritate them in a way that radiates outward. There are a few features that can help you tell it apart from ordinary back or muscle pain. It often gets worse 30 to 60 minutes after eating. It tends to worsen when lying flat. And over-the-counter pain relievers or heat don't do much for it. If that pattern sounds familiar, it's worth describing to your doctor exactly like that, including when it happens and what makes it worse, rather than just saying your back hurts. The third sign shows up at the dinner table. You sit down, eat a few bites, and feel unexpectedly full, so the appetite decline gets chalked up to getting older. But a growth in the pancreas can press against the nearby stomach, physically limiting how much it can comfortably hold, while reduced digestive enzyme production means food sits there longer than it should, sending full signals to the brain sooner than normal. The result is unintentional weight loss, sometimes fairly quickly, because the body isn't absorbing the nutrients it needs. Losing more than about 5% of your body weight over a few months without trying, or losing 10 to 15 pounds with no real change in diet or activity, is something to flag for your doctor rather than treat as a welcome surprise. The fourth sign is visible: jaundice, a yellowing of the skin and the whites of the eyes, caused by the same bilirubin buildup that darkens the urine. In people with darker skin tones, this can be easier to spot in the eyes or the palms than on the skin itself. It often comes with intense, all-over itching that doesn't respond to lotion and isn't explained by a rash because the bilirubin buildup irritates nerves from the inside. The tricky part is that jaundice is also a hallmark of gallstones, which are common and usually far less serious, so doctors reasonably check for those first. That's exactly why it helps to mention the fuller picture at once. The darker urine, the pattern of pain, the early fullness, and the yellowing together, rather than describing the jaundice on its own. The fifth sign catches a lot of people off guard because it doesn't seem related to digestion at all. An unexplained blood clot, often deep in the leg, causing swelling, warmth, and a heavy ache that doesn't ease with elevations. Certain cancers, pancreatic cancer among them, can affect how the blood clots, making unprovoked clots more likely even without surgery, injury, or a long trip to explain them. This matters because a clot can occasionally travel to the lungs, and sudden shortness of breath, sharp chest pain with breathing, or a racing heart is a reason to seek emergency care immediately, not to wait and see. Research has pointed to unexplained clotting sometimes appearing months before a pancreatic cancer diagnosis, so if you've had a clot with no clear cause, it's reasonable to ask your doctor whether it's worth a closer look at the abdomen as well. The sixth sign is a fever that keeps returning without an obvious reason. It's not usually high, but it comes and goes over days or weeks, sometimes with chills or night sweats mixed in. An ordinary infection typically resolves and stays resolved. A fever that shows up, fades, and returns again over an extended period is different, and it's worth mentioning as its own pattern rather than treating each occurrence as an isolated cold or bug. The seventh sign is a specific kind of exhaustion that doesn't respond to rest. You can sleep a full night and still wake up feeling drained, and ordinary tasks like carrying groceries or walking to the mailbox feel disproportionately hard. Cancer cells draw on the body's energy and nutrients, competing with healthy tissue for fuel, which is part of why this kind of fatigue doesn't resolve with sleep the way normal tiredness does. If this kind of exhaustion has lasted for several weeks without another clear explanation, it's a sign worth bringing up rather than attributing entirely to age. The eighth sign happens in the bathroom, and people are often reluctant to mention it, even to a doctor. The pancreas produces enzymes that help break down fat in food. When a growth blocks that process, undigested fat passes through the digestive system, and stool can change noticeably, turning pale, almost clay-colored, looking greasy or oily, sometimes floating, and smelling unusually strong. This is a fairly direct signal that the pancreas isn't functioning properly, and it often coincides with feeling sick after eating fatty foods. If this pattern lasts more than 2 weeks, it's worth calling your doctor rather than waiting to see if it resolves on its own. None of these signs are proof of anything on their own, and most people who experience 1 or 2 of them will not have pancreatic cancer. Many are explained by far more common and far less serious conditions. But the reason to know them is that pancreatic cancer's poor outlook has much more to do with how late it's typically caught than with it being untreatable. Stage 1 and Stage 4 are very different situations, and the biggest factor in which one gets caught early is simply whether someone said something when the signs first appeared instead of waiting. So if any of this sounded familiar, here's a practical next step. Write down what you've noticed and when it started, the color changes, the pain, and what makes it worse or better, appetite and weight changes, energy levels, anything about your stool that's changed. Bring that list to your doctor and describe it specifically rather than summarizing it as just feeling off. If a symptom persists for more than 2 weeks despite reasonable explanations, it's worth raising directly, and if you feel your concerns aren't being taken seriously, it's entirely reasonable to ask about imaging like a CT scan or ultrasound. You know your own body better than anyone else does, and that's worth trusting. If this was useful, it would help a lot to have you along for future conversations like this one. If you'd like to see more of these, subscribing means you won't miss the next one. And it also helps this reach other people who might be dealing with the same confusing symptoms and not know what to make of them. If someone in your life has been dismissing a nagging back pain or unusual tiredness as just getting older, sharing this with them might be exactly the nudge they need to bring it up with their doctor. Getting to 1,000 subscribers would genuinely help keep this kind of information going out to more people who need it. So if you found this helpful, I'd appreciate you sticking around for what's next. Take care of yourself, pay attention to what your body is telling you, and don't be afraid to speak up about it. I'll see you in the next one.